Hi, this is Dr. Nikita. I'm an aesthetic physician as well as a hair transplant surgeon at Max Eye Clinic. So the hair examination is the most crucial part when it comes to a hair consultation. So how do we consult? We firstly look at the frontal hairline. So if we see this hair thinning or hair breakage in the frontal hairline, this kind of denotes the initial stages of hair loss. So for this particular client, you can see that there's little bit of breakage and thinning in the sides and in the center portion. So my treatment will be based on this frontal hairline getting a regrowth. So apart from this, we do something called the hair pull test. So I gently take a portion of her hair and then I kind of give a tug and then I pull it out. So for this particular patient, there's no hair coming out, but approximately 25 to 30% of the hair comes out during this pull test. It's called the active pull test, which means the client actually has active hair fall. So our treatment will be based on retention more than restoration. So we will actually try to reduce or stop the hair loss. Then apart from this, we have something called the partition. We part the client's hair into two, from the frontal hairline to the back, and we compare the partition. So if the frontal hairline partition and the back side matches, then there's no active hair fall or there's not hair fall for a recent time. But if the frontal hairline, the partition is a bit more wider than the back portion, then that means there's some kind of a genetic reason behind the hair fall. So our treatment will be mainly focused on the frontal part. So for female, usually the hair loss happens in the center part, which is the midline, and for men, usually it is on both sides. So the treatment for men and female differs based on their kind of genetic predisposition. Apart from this, if the client is taking a hair treatment and we want to check whether there's any regrowth happening during this hair treatment, we do something called the paper test. So we take a strand or a section of hair and we place it against a piece of paper and we compare the base with the ends of the hair. So if there's any regrowth happening, the base of the hair will look more wider, more thicker than the ends of the hair. So this denotes that we are in the right path of treatment and we'll continue the treatment. Or if there is no changes and the base and the roots look the base and the ends look the same, then we will give a different kind of treatment. So lastly, we do something called the Proscope or the Dermascope, where we place this device on the scalp of the client. So this not just shows us how the hair looks, but also the scalp looks. So we'll be able to determine the scalp health. So say you have dandruff or you have oily scalp, itchy scalp, or some kind of ring infection, or there's thinning of hair happening, all this will be quite evident during this procedure. Or if you're actually going for any treatment or you've gone for your surgery, you'll be able to see the growth of the hair and particularly how many hair is coming out from a particular follicle. And if there is any thinning or if there is any regrowth during the procedure, you'll be able to see it much better in this procedure. Or during consultation, when you have any particular patches of baldness, you will be able to completely locate all kinds of bald patches when you do this particular treatment. So this is the final step when it comes to a hair examination. So put all these sessions together, your hair examination will give you the best possible treatment option, and the treatment option for every client will be varying, it will be different, customized and suitable for that particular hair loss and that particular scalp condition. So this is how we do consultation here.